Hello, and welcome to Dornsife School of Public Health's 2020 Public Health Immersion program. My name is Caroline Voiles, and I'm the Director of Student Placement and Partnership Development at Dornsife. I'm joined by Jordan Wood, the Practice Office Assistant and an undergraduate senior. Today, you'll hear from some of our faculty and alumni about how they apply public health research and practice in contributing to the well-being of local, regional, and global communities. Additionally, this module will feature examples of how Dornsife students have the opportunity to apply classroom teachings towards making a difference in the world of public health.
Welcome to Module 4, Housing and Homelessness. In this module, you'll hear about how the work of Dr. Yvonne Michael and MPH alum Thomas Jackson improves health and well-being related to this topic.
My name is Yvonne Michael. I'm a faculty member in the Department of Epidemiology and Biostatistics at the Dornsife School of Public Health. Today I'll be talking about housing, homelessness, and health. I'll begin with information about the current context. Right now, millions of Americans are at high risk for evictions as a result of the coronavirus pandemic. Recent research suggests that nearly 30 to 40 million people are at risk of being evicted because of job losses tied to the pandemic. Many of those evicted would be homeless, unable to find suitable housing. The federal, state, and local governments have mobilized to create programs to keep people housed during the current crisis. The Federal Coronavirus Aid, Relief, and Economic Security, or CARES Act, provided stimulus payments and unemployment insurance to families, but in many cases not enough to make ends meet. For example, Philadelphia initiated a short-term rental assistance program using CARES funding, but the city ran out of money after awarding funds to only 4,000 households, or less than 40% of eligible applicants after just a couple of months. Pennsylvania temporarily limited evictions to provide protection for renters until August 31st. Philadelphia City Council also passed several bills to provide temporary protection to tenants. These programs are expected to reduce, but not completely prevent, mass evictions, which will further strain city housing services. The risk of eviction and homelessness during the coronavirus are not equally distributed in the U.S. or here in Philadelphia. Unemployment due to the pandemic and evictions disproportionately affect Philadelphia's Black and low-income renters. For example, more than a quarter of eligible applicants for Philadelphia's COVID rental assistance program lived in only 5 zip codes, primarily in Northeast and West Philadelphia. While housing insecurity was exacerbated by the pandemic, it is not new. Philadelphia is the nation's poorest big city. Almost half of Philadelphia's more than 1.5 million residents live in rental housing, and more than 300,000 struggled to pay rent before the pandemic. Over the last 10 years, affordable units for low-income renters in the Philadelphia region have become 50% more scarce. 80% of poor families in Philadelphia pay more than half of their income for housing, making them extremely vulnerable to losing housing in any type of economic shock. Landlords attempt to evict more than 20,000 Philadelphia households each year. In 2016, there were 10,264 evictions in Philadelphia. That amounts to more than 28 households evicted every day. In addition to cost issues, a number of Philadelphians live in housing that is physically hazardous. According to the 2013 American Housing Survey, 17% of poor households in Philadelphia were living in inadequate and unsafe housing. More than 5,780 people in Philadelphia were homeless during the annual one-day count in January 2018. The picture emerging from these data is that of a crisis of housing insecurity in the U.S. and in Philadelphia. Already problematic, the coronavirus pandemic has significantly worsened the issue of housing insecurity. The goal for this lecture is to describe the place of housing in public health, now and historically. Summarize some of the drivers that lead people to live in poor housing or to be homeless, and to identify policies and programs that may improve housing outcomes and ultimately health. I'll focus on the role of racism in creating and exacerbating inequities in housing. I'll also describe some research conducted by me and my colleagues. Housing is part of the built environment and an aspect that links fundamental causes to health. Macro-social factors and inequalities shape the neighborhood built environment, including the housing we live in. Along with other aspects of the built environment, housing influences proximate health-related factors, including stress, health-related behaviors, and social integration and support. These proximate health-related factors, in turn, influence health and well-being. Adequate housing is universally viewed as one of the most basic human needs. The United Nations identifies a fundamental right to adequate housing and defines this as legal security of tenure, availability of services, materials, facilities, and infrastructure, affordability, habitability, accessibility, and location and cultural adequacy. But what does this really mean? The WHO defines healthy housing as shelter that supports a state of complete physical, mental, and social well-being. Healthy housing provides a feeling of home, including a sense of belonging, security, and privacy. Healthy housing also refers to the physical structure of the dwelling and whether it is structurally sound, provides shelter from the elements and from excess moisture, facilitates comfortable temperatures, adequate sanitation and light, sufficient space. Additionally, healthy housing also depends on the immediate housing environment, which provides access to services, green space, and active and public transport options, as well as protection from waste, pollution, and the effects of disaster. The definitions of substandard housing are drawn from the sanitation movement of more than 100 years ago, which focused on addressing water and airborne communicable diseases. These fundamental aspects of housing have been documented for centuries. In the 19th century, Frederick Engels wrote that the working class live in wretched, damp, filthy cottages, that the streets which surround them are usually in the most miserable and filthy condition, laid out without the slightest reference to ventilation. In the working men's dwellings, we find no cleanliness, no convenience, and consequently, no comfortable family life is possible. That in such dwellings, only a physically degenerate race, robbed of all humanity, degraded, reduced morally, and physically to bestiality, could feel comfortable and at home. Another important account of inadequate housing came from New York City during the cholera epidemic in the 1830s. A report explained that poor residents were much more likely to die because they lived in the worst houses in the most crowded portions of the city and could not afford to flee when threatened by the epidemic. Basement apartments were from 6 to 4 feet below the surface of the ground, and from these warrens came the greater proportion and worst forms of cases. Notably, the public health movement was in direct response to these observations of the connection between housing and health. Following this report, the first Public Health Act empowered a central board of health in New York City in 1848, beginning the modern era of public health. Now that we've defined housing and started thinking about how it's related to health, let's better understand the connection between housing and health. The Robert Wood Johnson Foundation identifies 4 primary pathways linking housing to health. First are the health impacts of conditions inside the home, the safety and quality pathway. Second are the health impacts of not having a stable home, the stability pathway. Third are the health impacts of the financial burdens resulting from high-cost housing, the affordability pathway. Lastly are the health impacts of neighborhoods, including both the environmental and social characteristics of where people live, the neighborhood pathway. I'll briefly highlight several recent studies that illustrate these pathways. Safety and quality is sometimes referred to as the direct or physical pathway through which housing influences health. Substandard housing conditions such as water leaks, cold and damp conditions, poor ventilation, and pest infestation have an impact on health outcomes, especially respiratory diseases such as asthma. Also included in this pathway are poisons, including lead and carbon monoxide, indoor air pollution, including radon or tobacco smoke, and hazards, including steep staircases or unsecured windows. While public health measures have had the most impact on mitigating these safety and quality issues, research continues to find an effect of substandard housing on health. An innovative study conducted in Cincinnati used data collected from housing inspectors documenting housing code violations, including the presence of pests or mold, as a measure of substandard housing conditions. These data were linked to asthma-related emergency room visits or hospitalizations. The map shown here summarizes the connection between housing violation and asthma rates. The black dots show the location of the housing code violations. As the dots cluster or are more dense, this indicates areas with higher frequency of these violations. The census tracts are color-coded based on the rates of asthma-related ER visits or hospitalizations, with yellow indicating the lowest rates, with rates increasing as the colors of the census tracts become darker, so that purple tracts have the highest rates of asthma. You can see the pattern. The places with the most housing violations and the places with the highest rates of asthma were often the same places. A quantitative analysis was consistent with this picture. The authors found that increased density in housing code violations was associated with asthma independent of poverty, and 22% of the variation in rates of asthma were explained by the density of housing violations. I'm going to talk about the next two pathways, the stability and the high-cost housing pathways, together, because they are closely connected and difficult to tease apart. It seems apparent that lacking a stable home or homelessness is connected to health. However, homelessness can be hidden. There are estimates that counts of homeless people miss up to 80% of people who are at risk of being evicted or spend more than 60% of their monthly income on housing. So high costs of housing cannot be easily separated from the issue of stability. Clearly, some of the physical issues identified in the safety and quality pathway are relevant in this pathway. For example, those who are unhoused are at extreme risk from exposure to the weather, including damp and cold. However, other softer issues are also important in this pathway. Beyond providing adequate shelter from the elements, housing provides refuge in a social and psychological sense. Psychological safety of residents is maintained when 4 housing conditions are met. When home is a place of constancy, when home is a place in which the day-to-day routines are performed, when home is the place where people feel most in control, and when home is a secure base around which identities are constructed. Conversely, unstable housing means these conditions are not met, resulting in poor physical health and mental illness. Economic and housing distress can force people to make hard choices between basic life necessities and paying for health care. In the absence of stable housing, residents are unable to maintain healthy routines, including healthy diets, physical activity, and primary care. Or the stress of instability directly influences mental health. Recent research conducted in 5 urban areas, including Philadelphia, measured the levels of housing insecurity in over 20,000 pairs of children and their caregivers who rent their homes. Among these families, 34% experienced at least one of the adverse housing circumstances. 27% had been behind on rent. 8% had made multiple moves, and 12% had a history of being homeless. 13% of the families experienced 2 adverse housing circumstances, and 1 experienced all 3. Compared to those with stable housing, caregivers that experienced housing insecurity were more likely to have poor health and depressive symptoms. Children with unstable housing had higher rates of hospitalization and poorer overall health. In another recent study, investigators evaluated the association between evictions and drug and alcohol mortality. They measured county-level rates of evictions in the U.S. from 2004 to 2016 and compared that to county-level mortality rates from substance use, including opioids and alcohol. They took neighborhood-level socioeconomic status, including poverty and racial composition, into account in their analysis. They found that higher levels of eviction rates were consistently associated with higher rates of mortality. Further analysis revealed that findings were specific to urban counties and that the association was not significant in rural counties. The authors concluded that increased eviction rates may worsen substance-related mortality. Other research investigating housing stability in relation to health evaluated gentrification. Gentrification is the process of large increases in socioeconomic status in historically low-income urban neighborhoods. Gentrification may make it impossible for housing insecure families to remain in their home because of rising costs. Or, if poor families remain, they may struggle as a result of a much larger cost of living. Research in this area is relatively sparse, but one study in California found that adults living in gentrified neighborhoods had significantly more psychological distress relative to living in a low-income and not gentrified neighborhood. Another study in New York City found that children who remained in gentrified neighborhoods experienced increased diagnoses of anxiety and depression compared to children in neighborhoods that remained poor, but the effects were overall small. The final pathway is the environmental and social characteristics of neighborhoods. In addition to the direct effect of the place in which we live, the area surrounding our home also may influence health. The availability of resources such as public transportation to one's job, grocery stores with nutritious foods, and safe spaces to exercise are all correlated with improved health outcomes. Social characteristics of neighborhoods, including social capital and racial segregation, may also influence health. So now we've established a number of pathways connecting housing to health. What do we know about access to healthy housing? Access to healthy housing varies by race, ethnicity, and income. We have significant disparities by race, ethnicity, and income in substandard housing, and these inequities have not been substantially reduced over time. The CDC reported in 2011 that Black and Latinx adults were 2 times more likely to live in substandard housing compared to white adults. The poorest adults were 4 times more likely to live in substandard housing compared to the richest adults. But why do these disparities in housing exist? To understand that, we need to look at housing policies that resulted in segregated neighborhoods and ensured that Black people and anyone not considered white lived in poorer quality, substandard housing. Thousands of Black people left the South and migrated to Philadelphia at the beginning of the 20th century. The number of Black residents in Philadelphia tripled between 1920 and 1930. Black residents found federal policies in Philadelphia that encouraged mortgage lenders to withhold credit from older urban neighborhoods, immigrant communities, and especially areas where African Americans or other people of color lived. Known as redlining, banks and federal agencies marked maps of the neighborhoods where mortgages should be withheld with red ink. In addition, racially restrictive deeds were used to further limit access to Blacks. The deeds for thousands of Philadelphia homes included racially restricted covenants, language barring minorities from buying into neighborhood or even living in it. Redlining in these covenants ensured that Blacks were limited to segregated neighborhoods with poorer housing, while neighborhoods with race restrictions went on to have better access to services, parks, highways, and other amenities that contributed to home values for decades. Home ownership is tied to wealth in the United States, and our system has perpetuated a racist, self-perpetuating system that still exists today. So how can we address systemic racism that results in blacks being considerably more likely to live in unaffordable rentals or to own homes that are substandard and would require considerable funds to repair. While there are a number of policy and programmatic approaches, I'm going to focus on one important type of program which provides funds and repairs to poor homeowners. These repairs address some of the safety and quality issues while also helping to ensure that these residents can continue to live in their home. Here in West Philadelphia, LISC has convened a collaborative of community organizations and home repair providers to assist low-income and mostly minority homeowners. The Home Preservation Initiative, or HPI, aims to improve the safety, energy efficiency, and overall quality of homes for low-income residents of West Philadelphia. Working with colleagues at the Urban Health Collaborative, we interviewed residents of the neighborhoods around Drexel who received services from HPI to better understand their experience of how their health was influenced by where they live, their home, and the neighborhood. In 41 interviews, neighborhood residents described many of the pathways linking their housing to health identified earlier in this presentation. They described structural flaws and damage to windows and walls, resulting in exposure to the weather and dampness or mold. They described uneven floor or carpeting, increasing risk for injuries. They described high cost of maintaining housing as a source of instability. Participants identified a number of tangible benefits from the repairs. The most common health benefit reported by participants was improvement in mental health. Repairs to home and remodeling reduced financial stress, improved pride in home and neighborhood, and improved mental well-being. Residents' own words provide additional detail regarding their experience with HPI. In terms of safety and quality, everything, especially the roof, affected health. After the roof was done, it was a big difference. The rooms were warmer and provided the ability to be comfortable. In terms of the impact on neighborhood, HPI has a strong impact. You come into a community and you don't see a bunch of dilapidated buildings. It makes it more cheerful. It's a pleasant neighborhood. So to wrap up, housing and homelessness are fundamental causes of health. Structural factors limit access to adequate housing. Programs and policies are needed to improve access and address structural inequities. Here's my contact information, and I look forward to meeting many of you while you are at Drexel.
Next up, you'll hear from Thomas Jackson.
Hi everyone, my name is Thomas Jackson and I am a recent graduate of the Master of Public Health program with a concentration in health management and policy, and I'll be talking about the public health implications of housing and homelessness. For starters, my public health area of interest is the social determinants of health, and these are all the conditions in which we live, learn, work, play, and grow that have non-medical impacts on our health and well-being. So looking at housing as a social determinant of health, I'm sure you can imagine what some of the health implications would be if you didn't know where you were sleeping at night. People experiencing homelessness are at a huge disadvantage socially and economically, and they are much less likely than people with the privilege of a stable living environment to receive needed medical care, especially due to their inability to access and pay for that medical care. Think about all the applications you've ever filed, whether for jobs, for school, or for health insurance. They all ask you for a physical mailing address. If you don't have a physical mailing address, it's hard to get a job, it's hard to get health insurance, and if you can't find a job and you can't find health insurance, things like exercising, eating healthy, and going for regular checkups would understandably be some of the last things on your mind. Furthermore, it's critical we understand that homelessness and housing instability disproportionately affect minority populations, especially people in the African American and LGBTQ+ communities. So I decided to complete my first-year depth experience as a policy analyst at People's Emergency Center. The People's Emergency Center, or PEC, is a nonprofit organization in West Philadelphia that provides social services for children, youth, and families experiencing homelessness. PEC leverages community partnerships to improve physical well-being at the intersection of housing, education, and health. My first week of this internship, my preceptor sent me to City Hall to listen to testimonies given during a municipal budget hearing. My assignment was to take notes on any City Council members' questions and the responses to those questions as they pertain to housing and homelessness. One of my biggest projects was developing a database of stakeholders, which were influential people in the community and in government at the municipal, state, and federal levels. I then used this database to communicate policy information to these stakeholders. I researched homelessness with emphases mostly on health and education, but occasionally also on economics. I then compiled my findings into policy briefs and memos. And on the left, I've included screenshots of 3 of the briefs I wrote that are now published on PEC's website for public access. The first of these briefs and memos that I distributed to stakeholders were advocating for co-sponsorship and passage of the Fostering Independence Through Education Act of 2019, which has since been signed into law by the Governor of Pennsylvania. This law is providing college tuition support vouchers to former foster care youth. Other work here involved advocating for the U.S. Department of Housing and Urban Development, or HUD, to reconcile their definition of homelessness with a more inclusive definition used by smaller agencies and advocates across the country to count more than just those people who sleep in shelters or on the street, but everyone without a stable living environment, so that everyone experiencing homelessness has access to the resources they need. I went to meetings with the Mid-Atlantic Regional Administrator of HUD, with legislative aides, and even with U.S. Representative Chrissy Houlihan of Pennsylvania's 6th Congressional District. And near the end of my internship, I received an email from Pennsylvania State Representative Donna Bullock to speak about my work at a press conference at the state capitol. For my second year integrative learning experience, I worked as a research assistant at the School District of Philadelphia, where I am still working today. Similar to housing, education is also widely regarded as a critical social determinant of health. This work involved evaluating sex education and nutrition initiatives across Philadelphia's public schools. I also currently evaluate sex education curricular materials for inclusiveness, medical accuracy, and age appropriateness. Advocating for health policy is a personal passion of mine that I have carried into lots of other things that I've done. As an example, since 2017, I have been an active member of Students for a National Health Program. This is a national organization of health profession students who advocate for universal health care. And on the left is a one-pager that I've just released in an effort to recruit public health students to the organization. I currently serve as an allied professions delegate for Students for a National Health Program, but in the past I was also the National Political Advocacy Chairperson, where I developed seminars and trainings on inclusive advocacy practices. I also worked with the American Medical Student Association earlier this year, where I was an advocacy coach for medical students. I then led teams of these medical students in lobbying federal lawmakers to support bills that combated gun violence and provided economic relief to those at risk of losing their homes and their health coverage amid the COVID-19 pandemic. In 2019, back in November, I was selected for the Student Leadership Institute, which is the American Public Health Association's intensive crash course on applying design thinking to emergent challenges in public health. I have also reviewed and scored abstracts that were submitted for the organization's upcoming national conference this fall. I'm telling you all these things to show that there is certainly no shortage of opportunities to get involved and do work on subjects you're passionate about. Throughout these experiences and my time at Drexel, probably the most important things I learned were to cultivate relationships and establish a network of people who can help you succeed. These people can be professors, mentors, preceptors, and even fellow students, just to name a few. You will learn to do public health work, but in doing your internships and other required activities, you should strive to do work that helps you develop skills that will make you hireable and set you up for success. To me, public health is about compassion for people. You usually don't get into this field without hoping to have a positive impact on the lives of others. Whether it's disease surveillance, reforming health policies and systems, conducting research, or protecting the environment, There are countless ways to make your mark in public health. My best advice to you would be to step out of your comfort zone, explore your interests, and never stop searching for ways to apply your talents and to make a difference. If you're like me, you probably have big goals you hope to accomplish in your career in public health. These are great for being your guiding light, but please understand that there are smaller things that need to be done to make those goals realities. Public health is a very creative field, and it has roots in virtually every other field, so keep an open mind to all the possibilities to create the change you hope to see. I wish you all the very best, and I can't wait to hear about all the wonderful things that you will do.
This slide highlights one of the recent Dornsife student experiences related to the topic of housing and homelessness. Each year, the City of Philadelphia organizes a point-in-time count or a census of those experiencing homelessness. Dornsife students from all degree programs have been able to participate in these yearly activities, surveying those affected and providing referrals to services.
The organizations listed here are examples of some other relevant organizations in Philadelphia that have worked with our students in academic internship placements or accept volunteers. Opportunities for student placements may arise closer to spring, but students are encouraged to seek information about organizations that align with their interests.
Thank you for viewing Module 4 of the 2020 Public Health Immersion program. As a reminder, Dornsife students who complete all 5 online modules and attend at least one of the synchronous sessions are eligible to receive a certificate of completion by completing the relevant evaluations. We welcome your feedback. The rest of these modules can be found on the Immersion program website. Stay tuned for information about the upcoming live virtual sessions that will allow students to explore these topics within the context of community-level disparities. These 3 sessions are population-focused, with panelist faculty on Black health, immigrant health, and LGBT health. We look forward to hearing about your experiences with the Immersion program at Dornsife broadly and as you continue in a career in public health.